Let's look at the prostate gland. The prostate gland is an accessory reproductive organ in male. As a matter of fact, it is the largest accessory organ of the male reproductive system. So let's dive into this lecture to see what the prostate gland entails. It is a fibromuscular-glandular organ, which means that it is made up of fibrous tissue, muscular tissue, and also glandular tissue. So it's more like a 3-in-1 organ, and it is conical in shape. It is an inverted conical shape, which means that the apex is pointing downward while the base is pointing upward. So it is conical in shape, but inverted. And this is the prostate gland located around the neck of the urinary bladder. This is the urinary bladder, and around the neck of the urinary bladder is where you have the prostate gland. It is like the size of a walnut, and it weighs about 20 to 30 grams in normal or healthy subject. Talking about what the prostate gland produces, we know that the sperm cell is produced in the testes. So it runs through a tubular structure that is highlighted in green. We have fluid from one of the male accessory organs, which is called the seminal vesicle, and this is the seminal vesicle. So when it gets to this region where the seminal vesicle is, this is going to empty its secretion into this dot where we have the sperm cell. Then the journey further proceeds. So when it penetrates through the prostate gland, when it gets to the prostate gland also as an accessory reproductive organ in male, it tends to also empty its own secret into the ejaculate. And this is the prostate gland. Then this also further continues in its journey. When it gets to the region of the bulbourethral gland, this is the bulbourethral gland. This also empties its content into the semen. So as the sperm goes through in its journey, it gets fluid that be emptied into the tube, which form the semen. So the addition of the seminal fluid to the sperm cell will form the semen, and this seminal fluid is formed or secreted by the accessory male reproductive organ. So as the sperm cell proceeds in its journey, as it gets to one point or region where the accessory organs are located, they tend to empty their secret into it, and this will eventually form the semen, which will be seen like a thick liquid presentation, and that is what happens during this process. So we have accessory organs that are located around the male reproductive system. Secrets from the individual accessory organ, they have their own specific function. But what we'll be limiting this lecture on is on the prostate gland. So let's dive in to see what the anatomy of the prostate gland is and some clinical anatomy of the prostate gland. The prostate fluid. The prostate fluid is the substance that is secreted or produced by the prostate gland. This fluid is milky or whitish in appearance, and that is what is responsible for the whitish coloration of the semen. This substance is slightly acidic, and has the other accessory reproductive organs also had their own content to what is coming from the testes. The overall pH level will be alkaline. And what this does is that as they enter into the female reproductive tract, they tend to neutralize the acidic environment of the vagina, because the vaginal space is acidic, and when an alkaline medium mixes with it, it will tend to neutralize it. This is just to further prolong the lifespan of the sperm cell. So what is the function of this gland, apart from its secretion, helping to neutralize the acidic environment of the vaginal canal? Because we know that when this release is done, it is emptied into the vaginal canal. So what are the other functions that this fluid tends to present? Generally, they help to activate and protect the sperm cell. And how they are able to do this, because in their secrets, in the prostate fluid, we have calcium, a large amount of zinc, and also citrate, and this helps to give energy or strength to the sperm cell. There's also the production of the prostate-specific antigen, PSA. This antigen helps to break down the clotting factor in the sperm cell, thereby allowing the semen to remain in its liquid state. And what this does is that the sperm cell is able to swim freely when it is in the liquid state compared to when it is in a solid state. So it helps to maintain the liquid presentation of the semen so that the sperm cell are able to swim freely when they are being emptied into the female reproductive system. More so, this antigen It's also used as a biomarker in prostate cancer. And when the serum level of this antigen is measured, it can be used to deduce the functionality of the prostate gland. Also, the function that the prostate gland does is that it helps to squeeze the prostatic urethra. This is the prostatic urethra, the region of the urethra that runs through the prostate gland. So it helps to squeeze it. And when it does that, urine is being prevented from flowing during the process of ejaculation so that urine will not mix with the ejaculate or the semen. It tends to squeeze up the lumen or close up the lumen of the prostatic urethra so that urine is not being drained out and prevent it from mixing with the semen. And what this squeezing activity also does, apart from preventing the release of urine, is also to help squeeze and also direct the path through which the semen will move. So as it is squeezing it, it is pushing the semen down the tract and also in a way helping to close up this channel up so that urine is not being drained into the semen. We say that the prostate is a fibromuscular-glandular organ. The general structural component of the prostate gland is that they are made up of three basic types of tissue. They are made up of fibrous tissue, they are made up of muscular tissue, and they are also made up of glandular tissue. It is the glandular region of the prostate that is responsible for the secretion of the prostate fluid. So we have 70% of the entire structural component of the prostate gland to be made up of glandular tissue, and we have 30% to be made up of the fibromuscular tissue. You can see that the glandular region takes more of the structural components. And what the glandular region does, as we've stated, is that they help in the production of prostate fluid. The remaining 30% is made up of the fibrous tissue and muscular tissue. What the fibromuscular region does is that they help to squeeze or tighten up this lumen so that urine does not drain through it during the process of ejaculation. This is just in a way to prevent the mixing of urine with the semen. Also, the squeezing activity or the tightening activity of this urethra done by the fibromuscular region also is to help drain or push down the semen, because the semen will be emptied into this lumen through the ejaculatory duct, because it's coming from this region, is running, enters into the prostate gland, and is being emptied into the prostatic urethra. This is the prostatic urethra. So when it gets here, there's going to be squeezing of the region of the prostatic urethra so that the semen will be directed downwards, and it will also prevent it from flowing backward or upward into the urinary bladder, because the semen is not supposed to be in the urinary bladder. So this measure is put in place so as to direct or push the semen as soon as it gets to the prostatic urethra. It helps to push it downward, and also in a way it's helping to close up this lumen so that urine does not drain out of the urinary bladder. So that's the function of the fibromuscular tissue. You can see that they also have their own role to play, even though the prostate gland is designed to produce prostate fluid. So we can say that the prostate gland is not a solely glandular organ. So the entire configuration of the prostate gland is not just made up of glandular tissue. So where is this gland specifically located? The prostate gland is located in the lower pelvis, where we see the major pelvic viscera, which include the urinary bladder, the prostate gland, and some other structures. We've discussed about the urinary bladder in our previous lecture. You can go and check that up to upgrade your knowledge. We said that the prostate gland is located around the neck of the urinary bladder. So this is where you see the prostate gland located. It's highlighted in red between the neck of the urinary bladder and the urogenital diaphragm. So this is the neck of the urinary bladder, and this is where you have the urogenital diaphragm. This is like a pad of muscle that tends to hold the pelvic viscera in place. It's also good for us to describe the relations of the prostate gland, the structures that are related to it. Superiorly, the prostate gland is related with the urinary bladder. And this is obvious because we've said that it is located around the neck of the urinary bladder. So superiorly or above it, you have the urinary bladder. And then inferiorly, you have the external urethral sphincter. We said that the external urethral sphincter is located distal to the internal urethral sphincter. We have the internal urethral sphincter around the neck, and we have the external urethral sphincter around this region. It's also related inferiorly to the urogenital diaphragm. So you have it around this region, and also the root of the penis is also related inferiorly to the prostate gland. Then anteriorly, we have the pubic symphysis, and the pubic symphysis here is highlighted in black. You can see at the anterior region of the prostate gland. Then posteriorly, we have the rectum, the ampulla of the rectum, which is the expanded region of the rectum. That is why the prostate can be examined through rectal examination. When you have benign prostate hyperplasia or prostate cancer, it can be examined through the rectum. So the prostate gland can be palpated through rectal examination. So if you put your hand through the rectum, you can actually feel the posterior border of the prostate gland, and this can help in evaluating clinical conditions. Prostate ligament. Talking about prostate ligament, we mean that structures that help to hold the prostate gland in place. If you look at the way it is, most of the soft tissue organs do have ligaments that helps to hold them in place or connect them with the surrounding structure. And so also this is exhibited in prostate gland. So let's take a look at that, the ligament that helps to connect prostate gland with the neighboring structure. So the first one is the puboprostatic ligament, and this ligament connects prostate gland to the pubic symphysis. So you have an anterior support through this puboprostatic ligament. And this is the puboprostatic ligament. Then we have another ligament posteriorly that helps to create a posterior support for the prostate gland. If we remember a lecture on the urinary bladder, we said that we have a pouch that connects the urinary bladder posteriorly with the rectum. And this is the rectovesical pouch. It's like a fold of peritoneum that helps to connect the rectum to the urinary bladder. If you break down the name rectum and vesicle, that means it connects the rectum with the urinary bladder. Vesicle is the urinary bladder. So it's a fold of peritoneum that connects the urinary bladder with the rectum. And this pouch is highlighted in black. You can see it running from the urinary bladder down to the rectum. There's a fold of membrane that tends to extend from this pouch downward. And if it extends downward, it means it will be connecting the prostate gland with the rectum. And specific region of the rectum where it will be connecting to is the ampulla region of the rectum. So there's a membranous extension from the rectovesical pouch that's called the rectoprostatic fascia of Denovilla. This creates a posterior support for the prostate gland, thereby connecting it with the rectum posteriorly. And this is the rectoprostatic fascia. And this fascia, apart from creating structural support or helping to hold the prostate in place, it also helps to limit the spread of disease or infection from the prostate gland to the rectum. But it's also in a way helping to guide or creating like a barricade between the rectum and the prostate gland, thereby helping to limit the spread of infection. Talking about the lobes of the prostate gland are divided into lobes. So we have 5 lobes of the prostate gland, and the first one is the lateral lobes. The lateral lobes are 2. We have one on the right and one on the left. So let's take this configuration. This is the anterior view and this is the posterior view. So on both sides of the prostate gland, we have 2 lateral lobes. We have one on the right and one on the left. So this is the lateral lobe. In this image, because it's a sagittal view, the lateral lobe cannot be viewed. And this is the second lateral lobe. Then we have the median lobe. From the name median, it means it's along the median plane. We've said that this is the anterior configuration and this is the posterior configuration. So if we have along the median plane, there is a lobe that is located between the urethra and the ejaculatory ducts. This is the urethra around the anterior part, and we have the ejaculatory ducts, 2, one on the right and one on the left at the posterior region. So between the urethra, that's the prostatic urethra, and the ejaculatory duct, we have the median lobe. So if we look at this sagittal section to see the median lobe, because we said that the median lobe is located along the median plane, but between the prostatic urethra and the ejaculatory duct. And if you look at the sagittal image, this is the ejaculatory duct and this is the prostatic urethra. So between the prostatic urethra and the ejaculatory duct, we have the median lobe. So the region that is pointed yellow is the median lobe in the sagittal section. So we can see how we have represented in transverse section and also in sagittal section. The next lobe is the posterior lobe. The posterior lobe, from the name, it means it is located posteriorly. And this lobe, you will see it behind the 2 ejaculatory ducts. These are the 2 ejaculatory ducts highlighted in black, and behind it, you will see the posterior lobe, and this is the posterior lobe. Going to the sagittal sagittal view because we say it's behind the two ejaculatory ducts. This is a sagittal view. We can only see one of the ejaculatory ducts, and this is the ejaculatory duct highlighted in green. And behind it, we have the posterior lobe. So it means this is going to be the posterior lobe in sagittal view. So you can see the presentation in both sagittal view and also in T section. Then the last lobe is the anterior lobe. The anterior lobe is a non-glandular lobe. It does not have glandular tissue within it. And from the name, it is located anteriorly. So you see it anterior to the prostatic urethra. We said that this is the prostatic urethra. So anterior to it, we have the anterior lobe, and this is the anterior lobe. You can see that within this space, there is no deposition of glandular tissue. The anterior lobe for the sagittal section, we've said that it is located anterior to the prostatic urethra, and this is the prostatic urethra. So this lobe will now be the anterior lobe. So this is the anterior lobe. Components of the lobes. Within each of the lobes, what we have are about 30 to 50 branched tubuloalveoli glands, and this is what they look like. You have cells that are arranged around the central cavity, and this forms the acinus. From the acinus, the secret is released through a duct, through which the release or whatever that is secreted by the prostate gland is emptied into. So this is what is seen in each of the lobes. But there's a particular presentation or pattern that they are being distributed that tends to present the prostate gland in form of zones. So we have three main zones. So the first zone is the transitional zone. This zone is a region that is located around the prostatic urethra. And this name is being generated from the transitional epithelium that tends to line the prostatic urethra. This is the transitional zone. Then we have the central zone. From the name, it is centrally located and it is seen around the two ejaculatory ducts. So this is the central zone. Then on the outside or at the peripheral, we have the peripheral zone, just as the name implies. And this is the peripheral zone. And we can say that the peripheral zone takes the bulk of the region because it's like the largest of them all. It takes about 65 to 70% of the entire space, followed by the central zone that's about 20 to 25%. Then we have the transitional zone that ranges from between 5 to 10%. Then the last region does not contain glandular tissue, but of course it will be stated because it's a region of the prostate gland, and that is the anterior fibromuscular stroma. This region is located at the front. This region is devoid of glandular tissue, but of course it will be highlighted as part of the region of the prostate gland, even though the secreted substance are not seen within that space. They are basically made up of fibrous tissue and muscular tissue, and that is what you see in the anterior region. And this region is termed the anterior fibromuscular stroma. Let's look at the interior wall of the prostatic urethra. We already said that the prostatic urethra is a region of the urethra that lines through the substance of the prostate gland. So this is the region of the prostatic urethra. So if we try to extract this region, this is the presentation that we'll see. And looking at this presentation, if you look at the wall, you see a midline elevation, and this region is highlighted in black, and this is referred to as the urethral crest. This is the urethral crest. It's like a midline ridge that is seen along the interior wall of the urethra. Along the urethral crest, there's a rounded eminence that is seen along it, and this is referred to as the seminal colliculus or the veromontanum. And this is the seminal colliculus that is seen along the urethral crest. Although it's rounded, there are some distinct features that we need to know on the seminal colliculus. We have three distinct features on this region, and it's important for us to note. The first one is the prostatic utricle. This is the region that is highlighted in red, and this region is an embryonic remnant. It occurs as a result of the developmental process, and this is like a diverticulum that is created around the spots. Then lateral to the prostatic utricle on both sides, we see the opening of the ejaculatory duct. This is the ejaculatory duct on the right, and this is the one on the left. And it is in this region that they open into. So we have the opening of the ejaculatory duct on both sides, through which the right ejaculatory duct and the left ejaculatory duct open into. So that is the three distinct features that is seen on the seminal colliculus. Talking about the duct of the prostate gland, we said that the urethra passes through the substance of the prostate gland, and the prostate gland also has its own secret. So how does the prostate gland empty its secret into the lumen of the prostatic urethra? And this occurs through the prostatic duct. The prostatic ducts, these are highlighted in red, and you see them, they are about 10 to 12 dots. We said that at the central part we have an elevation, and on both lateral side you have a depression, and the depression is called the prostatic sinus. This sinus is where the prostatic duct will open into. So this is how the secret of the prostate gland is able to be released into the lumen of the prostatic urethra. Then blood supply and drainage. The arterial supply of the prostate gland is from 3 sources. This is our common iliac artery. We said the common iliac artery we divide into the external and the internal iliac artery, and that is why they are common. So from the internal iliac artery, we have branches that emerges from the anterior part of the internal iliac artery. The anterior branches of the internal iliac artery supply the prostate gland. So we have the prostatic artery, we have the internal pudendal artery, and we have the middle rectal artery. So these arteries, they emerge from the anterior border of the internal iliac artery, and they supply the prostate gland. Then the venous drainage, you have the prostatic venous drainage. The innervation of the prostate gland is through autonomic innervation. And we know that autonomic innervation, we have the sympathetic, which is during emergency state, and we have parasympathetic that occur during the normal process. So during the emergency state, the prostate gland will be innervated by the hypogastric nerve, while during parasympathetic state, it will be innervated by the pelvic splanchnic nerve. Clinical anatomy. The first clinical anatomy I would like to talk about is BPH, which is called the benign prostatic hyperplasia. This occurs when the prostatic cell begins to multiply uncontrollably. So when there's an uncontrolled multiplication of the prostatic cell, and this tends to increase the size of the prostate gland. And when this multiplication is benign, that means it does not have the capacity to spread through other structure. It is called benign prostatic hyperplasia. And this type of condition, we said that the transitional zone is located around the prostatic urethra, and this is the region highlighted in green. So this is where the benign prostatic hyperplasia mostly begins from. So it starts from this region, and we say that the middle lobe is located between the urethra and the ejaculatory duct. So it tends to affect more of the middle lobe. This comes with urinary complications, because if you see the transitional zone, if any defect is seen around this region, it's going to affect the prostatic urethra, which means urination will come with some form of difficulty. Most symptoms that we see is that there's going to be frequent urination, there's going to be urine retention, painful urination, anything that has to do with the process of urination will definitely be affected. A major treatment option will be the use of medication to relax the urinary bladder, also to shrink the prostate gland. So also, surgical procedure may be done. Enucleation, this is a surgical procedure to remove the middle lobe that's been affected. The second one is the prostate cancer. The prostate cancer is also common, just as we have the benign prostatic hyperplasia. And this is also an uncontrolled multiplication of the prostatic cell. When they begin to divide uncontrollably, it tends to create like an increase in size of the prostate gland. But the difference between the benign prostatic hyperplasia and prostatic cancer is that it mostly begins from the peripheral zone. So this is the peripheral zone on the outside, unlike the benign prostatic hyperplasia that tends to begin mostly from the transitional zone. And because we said that prostate cancer mostly will begin from the peripheral zone, when we do rectal examination, we can feel the posterior region of the prostate gland. And the posterior region of the prostate gland is where the peripheral zone is. So we can actually deduce whether this is a form of cancer or not, using our knowledge of the different zones of the prostate gland. Then the symptoms, because we said that it will begin from the peripheral zone, and it's cancerous because it has the tendency of spreading to other regions. So before it spreads to the central region and even the transitional region, it would have been at the later stage. And of course, this will present with a form of abnormality with the process of urination. So we still have that. It will mean that this will not occur at the initial stage of the cancer, because at the initial stage, we already know that it will begin from the peripheral zone. And in this region, it will not affect the urethra because it's not close to that space. Other form of symptoms may also be erectile dysfunction. Then basic treatment option is the use of chemotherapy, the radiation treatment option, or surgery as the case may be. So thanks for watching this video. Let's meet again.